and then a little look at where we're going. You've seen this before, just updated. All of the gray are the cumulative cases that we've had in Vermont. And as over the weekend, we're in the low 800s for cases. The blues are the new cases. I don't think it's a stretch to say that the slope of the curve has clearly changed, and it's really coming into that more plateau type of phase. This is called an epi-curve. This is really the curve of just the new cases from a day-to-day basis. So you could see, we were pretty accustomed to an average of 30 to 40 cases, with occasional times when we peaked here in the middle here and had 50 there. You may recall we began way back in early March, first case. And around this zone is where we started doing things like limits on mass gatherings, closings of restaurants and bars, and eventually schools, a lot of social distancing strategies, and then in this time frame, the actual stay home, stay safe program began. You go several weeks beyond that, and you see we've come from a peak and down nicely to generally below 10 cases over the last week on a day-to-day basis. And then finally, this is just the graph of number of tests we've done in Vermont. So each vertical bar is number of tests on a given day, and you see they generally range from 300 to 600 or 700 over time. The olive green color is the percentage of tests that were done in a given day that were positive for COVID-19. And that's on this y-axis, so it goes as high as 12%, down to just a couple percent. And you can definitely see the slope of that curve diminishing as well. So as a rough indicator of how much disease is in the population, showing decreasing number of positive tests over time. And most recently, we're in the low single digits. So our focus now, from now into the foreseeable future, remains to protect the most vulnerable, I would say even more aggressively than before, to continue to avoid exceeding the capacity of the healthcare system, and also to protect as many Vermonters as possible from encountering severe infection until we have effective antiviral therapies and a vaccine. And the timeline on effective antiviral therapies could be just months. The timeline on a vaccine, as you know, is commonly stated as 12 to 18 months. So as we look into the future, and you heard on Friday's press conference about the 5 sort of tenets of the way we're going, certainly from the health department point of view, we own the first several, but number 1 is keep our eyes on the data. So you'll see similar data to what I've shown you now, but also we'll be expanding to really understand what's the rate of immunity in the whole population in Vermont. Continue to look at how the healthcare system is being utilized in terms of hospitalizations, ICU usage, ventilator needs, hospital visits, visits to primary care for flu-like symptoms, COVID-like symptoms. What symptoms are the population reporting? Understanding a new category that the CDC has come out with of probable infection, meaning everything looks like COVID, but a test was never done to confirm that. And then an understanding of illness in children and adolescents, where we'll be coming out with a health alert notification to practitioners today regarding expanding testing in that population. We'll also be continuing to try to assess individual behaviors to see how much the population is complying with social distancing, mask wearing, mobility measurements, and how well businesses are actually contending with the appropriate behaviors to provide a both safe working environment for their employees and a safe environment for their customers. Now, you've heard a lot in the national news about some areas that the health department is going to be focused very closely on in the near future. We already are, but we'll continue to focus even more aggressively on these. First will be to maintain an aggressive strategy with regard to testing and having the adequate supplies to do that testing. There'll be more of an emphasis on rapid test results. We feel rapid is still pretty good at 24 hours, but there are times that one needs even more rapid, perhaps 20 minutes. We'll be working, again, with UVM to validate point-of-care testing machines that we could hope to distribute out to the population at large in practices or in hospitals. We'll be working more on that integration piece with pediatrics that I just mentioned. And I still would hope that we'll find a way to integrate this new regimen of a simple nasal swab in the front of the nose rather than something way back in the nose, and integrating that into practice if we can. Obviously, if you test, you need to have that followed up with an aggressive contact tracing workforce and stance, both of which we have already here in Vermont, and the opportunities to make sure we appropriately isolate and quarantine to, again, keep that level of disease in the population very, very low. When you put those two factors together, testing and contact tracing, along with the fact that we will be going 14 days without an increase in cases, hopefully, that's very significant, and we'll continue to have good hospital readiness without having to resort to what's termed crisis standards of care. These are all things that need to be in place to move along the continuum that the governor has outlined previously into what is now nationally be called a phase 2, if you will. Lastly, we need to and will continue to be as aggressive as possible and intensify our efforts to keep all long-term care facilities as safe and uninfected as possible. Something I think we're actually been doing very well with over a number of weeks in Vermont now, since we had the 2 larger outbreaks to start with. We're not seeing consistent evidence for major outbreaks throughout the state in long-term care. So that will have to be a major focus as well. I'll turn this back to the governor now.
Well, thank you, Dr. Levine. For the last few weeks, I know how difficult and frustrating it's been for too many as they've repeatedly tried to get through to the unemployment office, and especially for those still waiting for their very first check. And for many, this was the first time in their lives they've ever been laid off, so had no experience using the UI system. So in order to help more Vermonters get through on the phones, we're adding another 50 state employees and 50 agents with an outside contractor to bring the total number answering phones to more than 150, and a total of over 200 people now processing claims. But getting through on the phones was not the only obstacle, which is why I directed the Department of Labor to clear tens of thousands of issues which have been holding up Vermonters' benefits. As of last Thursday, the department had identified over 34,000 claimants with over 50,000 issues that were holding up payments. Under normal circumstances, investigating these issues is required to make sure we're adhering to federal regulations. But these are not normal times. And these very restrictive federal standards have made it difficult, if not impossible, to keep up with the demands this pandemic has placed on the system. The lack of flexibility has made an already complicated and bureaucratic program even more difficult. While I greatly appreciate the additional unemployment funding available through the CARES Act, our ability to get the benefits to people quickly has been burdened by stringent requirements set by the feds. So we were forced to make a choice, allowing a cumbersome process to delay money desperately needed by Vermont families, or find a way around it. In the end, we went with our heart and put people ahead of process. And the Department of Labor and the Agency of Digital Services rolled up their sleeves and found ways to clear issues to help payments go through when Vermonters file claims this week. And to confirm program integrity, the department will follow up after the fact to verify eligibility. By Saturday night, nearly 32,000 issues had been cleared, which means over 20,000 people will be cleared to file their weekly claims and start receiving their benefits. And as I committed to on Friday, we've acted to help those who did not have issues cleared get some relief as well. Working closely with Finance, alongside Treasurer Pierce and her team, we issued $1,200 checks to over 8,300 Vermonters yesterday, and I personally brought them to the mail center this morning. The Treasurer will share more on this team effort in a moment. We did this to get money to those in need, but for most, it's likely only a prepayment of their full benefit, with the remainder being paid through the regular process. I understand these delays have been devastating for Vermonters who are staying home to stop the spread and save lives, but who still need to put food on the table and pay their bills. Because there are risks to federal funding, we had hoped these issues could be resolved through the normal process, but it became crystal clear to most this was not happening fast enough, so we needed to find another way. While these steps should help provide some relief, please note, we're not going to let up until everyone who's entitled to get a check gets one every week. I want to thank everyone for doing their part by staying home to slow the spread of this virus, which is saving lives. So with that, we have Treasurer Pierce on the phone, and I'll turn it over to her. And again, Treasurer Pierce, I thank you for all your efforts of you and your team from yesterday.
Well, thank you very much, Governor. I want to thank you first for all your efforts. The Treasurer's Office had several staff in on Sunday to process the payments for 8,384 individuals, totaling over $10 million. This required the work of 4 of our staff working over 10 hours each on Sunday, as well as support from myself and our IT staff. I want to especially thank Deputy Treasurer Michael Clausen for coordinating this effort. I was pleased to see that the Department of Labor had cleared a substantial number of those claims Saturday night, which lowered the volume for my staff on Sunday, allowing us to process the payments in an efficient and timely manner while still adhering to customary internal control procedures. In Vermont, we work together in times of crisis, and I'm pleased that we jointly were able to process payments, whether through DOL or our office, so that Vermonters will have funds to meet their family needs in this severe and unprecedented crisis.
Thank you, Treasurer Pierce, and again, thank your team for me as well. With that, I think we're going to open it up to questions at this point.
All right, and we do have Commissioner Harrington in the room for those of you on the phone to answer questions, along with Secretary Smith and our usual team on the phone, Secretary Quinn, Commissioner Sherling, Secretary Curley, Secretary French, and Secretary Young. We're going to start in the room with Stuart.
Thanks. Where to start? Governor, we did have some additional deaths over the weekend, and I'm wondering if the numbers that we've seen since we last spoke on Friday give you some indication about whether you're going to be able to turn the spigot a little bit more this week.
I'm going to let Commissioner Levine answer part of that. I'm always watching the data. I keep track on a daily basis of how we're doing, how New Hampshire is doing, how Mass is doing, how New York's doing, how we're doing as a country. And so I keep track of that. Deaths isn't the only indicator, and every death is tragic. But we have to watch the number of positives as well. So we're tracking everything, and that will be more of an indicator as to one category, but I'll let Dr. Levine answer that.
So I did not comment on the deaths on this slide, but notice there in the darker blue. What can I say? There's not like a rapid increase in death. There's a steady trend of death across the board. Obviously, all of these are tragic, but the fact that they occur in the context of this epidemic is not an unexpected finding. And anytime we get 2 or 3, it's not an exception to what's been going on pretty much all along, statistically speaking. So I wouldn't want to, I would always want to focus on it, but I wouldn't want to focus on it in a way that it would derail any of the future plans, because the data doesn't indicate that that should happen.
Can you characterize the people who died recently, or give us some kind of demographic information?
A couple of the most recent were in long-term care facilities, and needless to say, elderly. And I'm pretty sure we're doing an assessment of all, I think we're up to 38 now deaths, and we'll have that out very soon. But if not 100%, almost 100% are in people in their 60s and much older. We've not seen a lot of younger people that die.
Again, I just want to stress that every death is tragic in the state. But when you compare us, like with Massachusetts, for instance, they have 10 times the population, but they have probably 3 to 4 times the death rate that we do at this point in time.
Calvin?
Thank you. So as I'm sure you heard outside, there's quite a big demonstration of a lot of people pretty upset about the potential plan to close the Vermont State College campuses. In an already strained system, what does a path forward look like for colleges?
Well, again, sometimes democracy is noisy and disruptive, and they have every right to show their displeasure. And so we accept that. This may be the tip of the iceberg in some respects, and we're going to have a lot of pending need throughout, whether it's municipalities, whether it's our healthcare system, our hospitals, and other institutions, as well as education. And that could be on the K through 12 as well as higher ed as well. So we've seen this over time. I mean, if you look back over the last couple of years, you'll remember Burlington College was the first, and then we had Green Mountain College, Southern Vermont College, Marlborough College, and there are others who are on the brink at this point. But that doesn't, again, this is our state college system. We want to protect that. This is something the trustees and the chancellor have been talking about for a number of years. We've been trying to do whatever we can, as you probably remember, in some of my budget addresses, as well as state of the state addresses. I've acknowledged that we have some problems, and we have throughout our system, whether it's early care and learning or higher education, and the amount we appropriate to both. So suffice it to say, this is some of the decisions we're going to have to make over the coming months, may be as difficult, or if not more difficult, than we've made thus far. So it's going to be challenging, and that's why I want to make sure that we have the legislature involved in this. I know other states have questioned whether the legislature should be involved at all in some of the COVID money, and I've embraced the fact that we do things different in Vermont. I want their involvement. I think we need their consideration. We all need to work together and trying to find solutions. So this will be a topic for us to consider. but there's not an infinite amount of money available either. And so whatever we do now, we have to consider what are the long-term effects. Is it sustainable? If we just inject money into any institution, is that necessarily going to mean they're going to be able to survive in the long run because they had financial challenges previous to this? So again, a lot of considerations over the next few months, but I'm thankful that they put off the vote for at least a week and giving everyone time to settle in and consider what's the possible.
Governor, you over the weekend, you brought up the fact that COVID money could possibly be used that way. Over the weekend, several alumni were floating the idea that UVM is asking for $25 million as a COVID relief, and they said if we could take that money instead and put it towards the state college system, that could float them for a couple of years to find a solution.
Well, let's be clear about what the state college system is asking for at this point, too. Even with the condensed proposal that they're bringing forward, they're asking for their ongoing benefit of, I think it's $25 million. They want another $30 million just with this new package. So additional money would be needed. Again, this isn't just for this one single instance. It's what do we do in the future? Because this is ongoing. This injection of dollars at this point in time isn't going to fix the long-term problem that they're facing, the structural changes that are necessary. So again, we will take this into consideration. UVM has asked for money as well, as will other institutions. Again, our hospitals are going to be in a great need when this is over because, as you recall, none of the procedures, elective surgeries and so forth, where they somewhat make their money, are able to be utilized at this point in time. So they're going to be in a desperate need as well as our K-12 system and other parts of government. So all the while, we're not taking any money in either as a state or in our individual municipalities as well. So this is going to be challenging, and I know it sounds like the relief, and I'm appreciative of everything our congressional delegation did to get us some money for relief, but that's not going to fix all our problems. And so we're going to have to make some choices, and collectively with the legislature, we'll do just that. We'll debate that and try and find solutions to the problems as they come forward.
As a follow-up, has there been any talk or discussion about the private sector getting involved? We've talked about the education needs of companies around the state. Is there a chance we could reach out to those?
Possibly. Again, I would say that some of these private institutions, the businesses themselves, are going to be challenged in the aftermath as well. So this is widespread. No one is going to be left untouched as a result of this pandemic. So again, it just reinforces the fact we have to work together on this. We have to be unified in trying to do everything we can to be smarter and better in the future about where we make these investments. Because if we just want to make sure that we're making the investment so that we contemplate the future, because we're not going to make everybody whole as a result of this. And that's not going to fix, again, some of the systemic problems that we face as a state. Over the last number of years, I've talked about the demographics. I mean, there's no one who hasn't heard me talk about the demographic challenges we face as a state. The number of students in our K-12 has decreased by 30,000 over the last 20 years. That has effect on our higher education as well, because those are the students who typically go to our state colleges. And so when we don't have the students enrolling, that means they have a problem on the other end. So it's all about enrollment, it's all about overhead costs, and again, we're going to have to work at this together.
All right, we're going to move to the phones. First up is Chris Roy, Newport Daily Express.
Yes, good morning. We're hearing this morning that some small business owners, particularly one- and two-person operations, are being denied unemployment benefits. and they're saying that there's no more money left in the SBA for them to get a loan. I'm wondering if somebody can comment on that. And I'm just wondering when some of these personal service businesses can expect to be able to reopen and have an income once again. Thanks.
Well, there is, Chris, first of all, there is the PUA, and that's the Public Pandemic Unemployment Assistance Program that was unveiled by the feds, by Congress, and that will allow those who are self-employed to receive unemployment benefits. Now, this program isn't up and going. We're hoping it will be this week. I'm going to let Commissioner Harrington talk about this a bit. But also the SBA loans that are desperately needed by those in Vermont and across the country. We've heard some good news this morning. It appears that there may be an answer to the logjam in Washington so that they can appropriate more money for that program. So we'll hear more from them, but it's really a congressional problem at this point. Commissioner Harrington.
Thank you, Governor. With regards to the Pandemic Unemployment Assistance Program, we are doing final testing today and tomorrow, and as soon as that is complete, we'll go live with the system. In a recent conversation we had with some others, it seems like that is on par with what other states are doing in terms of timeline. Just recently spoke with the state of Massachusetts, and their program is also going live this week as well. In terms of that perspective, there are a number of reasons why someone might not be eligible for unemployment insurance. I think this answers the question, though, if they're self-employed, but it also sounds like they're looking for business support as well. Thank you.
Okay, thank you.
Mike Donahue, The Islander.
Thank you, Governor. Good morning. Thank you for all the data that you've been pumping out. And you did mention comparisons with other states. One statistic that's been seriously missing and Vermont has been asking about are the number of cases per individual towns. How soon would the state of Vermont be able to start providing town by town listings, the number of cases each one has? So like instead of Washington County just having 32, are those all in Berry City or Montpelier? And I noticed the numbers in Franklin County say there's 93 in Franklin County, but I got to assume some of those are the inmates, and they're now in St. Johnsbury. So I'm not sure the numbers actually match up to where people are these days.
Yeah, I don't have the answer to that. I'm sure the data is being collected, but I'm not sure how it's being implemented. So I don't know if Dr. Levine could try and answer that.
This is a partial answer. So often in Vermont, when we get down to small numbers, you actually succeed, even though you've tried not to succeed, in identifying the individuals who are the cases, because within a town's experience, there may be one or two people in a rural state. So we are, we have to always be conscious of HIPAA violations and making sure that the way we portray the data does not isn't without consequence, I should say. The other aspect is it's very hard if you're looking more for statistical differences amongst various communities. It's often challenging enough just within geographic regions to have statistical significance, and when you get down to a town level, it becomes very, very impossible or challenging.
Well, Vermonters want to know if anybody in their town has it. And you've obviously provided small splinter groups, if you will, like at Bronson Health and Rehab. I'm sure their population is considerably less than some of the small towns in Vermont. So obviously there's a way to try to, I understand HIPAA may or may not apply. Obviously other New England states and other places are giving the numbers. So I'm just not sure why Vermont is different from these other states in not providing taxpayers case by case by town.
And I can work on a more thorough answer for you at a later time. but I will make a general statement since you've now given me the opportunity. I would think that any Vermonter, no matter what town they live in, would be foolish to think there was not a case in their town. This is a condition that travels across state borders, as we know, across town borders, and it has community-level transmission at this time. So even if the person in their town that has it doesn't know they have COVID, but they have other symptoms, they probably have it. So, you know, it would not be reassuring for someone to think that their town was not affected. Thank you.
No, I understand that, and I also understand people still want to know the statistics in their town. And one other follow-up question for the governor. The contract reference the vendor to bail out the Labor Department. How much is that costing taxpayers, and how long is that contract for?
Mike, this is Mike Smith, Secretary of Human Services. Let me answer the first question, which is the data. We'll look at the data and see what data we can provide and what data we can't at that point, but we'll get back to you on that, and then I'll turn it over to
Okay. Thank you very much.
Yeah, first a comment about, you know, in the beginning when we started hearing some of the cases of those who tested positive, protecting those, the identities of those through HIPAA and so forth, and maybe socially, just acknowledging or not acknowledging that someone has it, and it wouldn't be socially acceptable. I think that we're going to get to a point where it's going to be beneficial to actually have had it, and that you might be immune to it in the future. So that may change at some point in time. On the
A lot of people are talking about it.
Yeah, no.
I mean, a lot of people.
It's interesting.
We talk about it, Tom Hanks and others. So it's not like some other diseases that people may not want to.
Yeah, I think in the beginning it was viewed differently than it is today, and possibly in the future. So we'll have to contemplate that as we move forward. In terms of the contract, I think I believe it's a 3-month contract, and we're able to continue that if possible. It'll be we'll be able to use some COVID money to reimburse us for that. So it's all taxpayer money, but it may come from the Fed. So I'm going to let Commissioner Harrington answer the specifics, because I don't have the dollar amounts on top of my head.
So with regards to the Maximus contract vendor solution, it's a 3-month contract with the ability to renew over 3-month contract, ability to renew every 3 months for about a year. From there, we also pay a per customer service representative amount. So we may start at 50 customer service representatives. We have a contingency plan for up to 70. We can go higher than that, or if we find that demand shrinks over time, we can reduce that. So we pay a per customer service representative amount.
All right, we need to move to our next caller.
And what is that amount?
We have 20.
What is that amount?
Thank you.
Can you give a rough idea?
It's so the maximum allowable limit on the contract is $2 million, but roughly again it's probably about $100,000 to $150,000 a month, depending on the size of the number of customer service representatives.
Okay. We still have 20 people in the queue, so we need to move to Derek from 7 Days.
Yes, Commissioner Levine spoke again today of aggressive testing as a strategy for reopening. Last week, we still didn't have enough testing capacity to screen, entire groups of vulnerable populations in the prison system or in long-term care homes, for instance. I'm wondering if you can be more specific about where our capacity stands today in terms of the tests that can be conducted, per day or per week, and where it needs to be to move substantially along this continuum you referenced.
I'll let Dr. Levine answer that first, but I believe that we do have the testing capacity, and that's increased dramatically over the last 3 or 4 weeks. So, Dr. Levine or Secretary Smith.
Dr. Levine. I'll give it to Dr. Levine in just a minute. I just want to clarify something that you said. We have expanded our testing to to a number of facilities, long-term care facilities, for example, psychiatric, state-owned psychiatric facilities for another, residential treatment facilities, those with disabilities and disabled facilities, correctional facilities. Whereas if we have a case, we will test the entire population of those facilities. For example, we just tested the Vermont Veterans Home, for example, Decker Towers in Burlington. We tested the whole facility. So we have expanded, and in fact, I think the CDC has given us some congratulations on our testing ability in terms of what we're doing. So Dr. Levine, you want to continue on that?
Yeah, the CDC actually just recognized us for the amount of testing we're doing in some of these long-term care facilities. But I will reiterate what we said in the past. We're not just going into facilities who have no problems and testing the entire population. Although you might recognize a couple of the more recent ones that we've done actually may have proven that policy to be an acceptable policy, because we were finding, other than the index case that precipitated the entire testing, we were finding very little, if any, disease in those populations. So, but back to your broader question, which was just what kind of testing capacity we have. We calculate our testing capacity every day based on the level of testing that I showed you in one of the slides, whether it be 300, whether it be 600 or 700 tests per day. And then we also calculate it on the basis of an even higher maximum level. And clearly, with our current supplies, we have several months opportunity for testing at those levels. But we are trying to actually acquire more so that if there comes a time when we need to do even more expansive testing, we will always have some insurance in our back pocket, so to speak. Does that answer your question?
Yeah, thanks. I'm aware of the expanded capacity, but you know, the limitations were referenced in terms of why the state couldn't test every inmate in every prison, for example. So I'm wondering if we don't have the capacity to do testing that broad where there haven't been documented cases, if we need to get to that point before it makes sense to try to return to normalcy.
I'm not quite clear on exactly what you're saying, but I think even if we did test every prison right now, just went in there and did all the testing, we'd still have plenty of testing capacity for well over a month for the rest of the population.
Yeah, I had mentioned last week in terms of a question, why don't we go in and just pre-test every facility there is? And if we did that, if we did it with every facility in the state, in accordance to the list that we have, there would be a capacity issue, not just corrections, but a capacity issue as we move forward. We have 1,600 tests we can do daily. That is where we are, and so we are continuing to look at our testing ability and rapidly, and as I said last week, we have a robust testing system with, but it isn't unlimited, and so we continue to do that. By the way, when we tested the Veterans Home down in Bennington, we found no positive cases when we tested that in sort of a test, because there was a positive in March, but we found no positives there. We will continue to test correctional facilities if we have a reason to test correctional facilities. And again, where do you stop? If you test, you have no positives, do you test the next day and the next day after that or the next day? Because what you will have is no positives for that day. So we want to see a positive before we test in a universal way in a facility. Secondly, we're going to be following up with Northwest this week in the second series of tests that we will do at that facility to make sure that we in fact have found every COVID COVID-19 positive inmate and correctional officer in that facility. We'll continue that testing, and if that's the case, and we have inmates that are in St. Johnsbury, if that's the case, we'll move them. If it comes back clean, we'll move them back to St. Albans. So far, it's been Northwest State Correctional Facility, which we've had an issue with, and we've acted real quick on that facility.
All right, Kat, WCAX.
Hi. Given the continued plateauing of the curve and the loosening up of some restrictions on businesses already, can you give any Vermonters a sense of which businesses may be the ones to ease up and open up next?
Yeah, difficult at this point in time. We'll be contemplating those over the next few days. Obviously, we have a list that we're considering. ACCD is taking the lead on this, and they have a group that is trying to put together certain requirements. It's kind of a plan for each opportunity as we open up businesses. And I will say, there's a bit of a lag time as well. We want to keep track of the data and the trajectory and watch the modeling. But there could be a lag time between when we start. Like, for instance, today, we're opening up the spigot just a little bit to allow for 1 to 2 person operations to start in Vermont. Well, we won't know whether that's the right move for, over 7 days, probably 14 days before we are able to calculate some of that. But we want to make sure that we're moving in the right direction. If we continue to see the numbers not grow over the next few days, we'd like to open it up just a little bit more, and we will probably make some sort of announcement on Fridays if that if that number holds. But again, it all depends on what happens, and we're watching the data on a daily basis to make sure that we're not putting Vermonters at risk. We've done a great job thus far. We don't want to go backwards. We want to move forward.
Got it. So then, just to clarify what you were saying there, is it you're going to wait the 7 to 14 days after opening the spigot a little bit, or is it that you're going to wait a few days?
Well, no. Again, we'll just continue to watch the data every day, but just understanding, and I'd hope that we can make some announcement every week, so a little bit of a turn every now and then. But just beware that we may not know what we're doing today, and the results won't show up for 7 to 14 days. So even though we might make another adjustment on Friday, the following week on Friday we may see an uptick, and if we see an uptick, we may back off just a bit to make sure that we're not putting people at risk.
Got it. Thank you very much.
Joe, Barton Chronicle.
Hello, Governor. This may be looking down the line a little ways, but it seems that the problems that the state college system are having may have existed in some form before, but they've been exacerbated by the situation around the coronavirus. And as you said, hospitals are facing similar situations. Obviously, tax revenues are down, and they're going to continue to be down if people aren't earning money. So at the end of this, Vermont and all the other states, it appears, will be have huge holes in their budgets, and almost all the rest of them, unlike Vermont, can't run deficits. What I'm wondering is, have you begun to be in contact with governors from other states to talk about pushing for help from the federal government to backfill some of the damage that state governments are going to suffer from the coronavirus?
The short answer is yes. The National Governors Association, and I talk with members of that association almost every other day, certain people, and there's a mixed response, but for the most part, most of us would like to see some assistance from the feds to fill those budgetary holes that you described. But that's being debated in DC at this point in time in Congress. I know that some were trying to attach it to the SBA increase in funding for SBA loans, and I'm not sure if that's going to hold at this point. I think it's more important from my perspective to get the SBA money funded so that businesses can get relief. But I would hope that we continue to have this discussion and debate as to what to do next, because each and every community, each and every state, each and every business is going to have incredible financial challenges in the future. So this is going to be an issue for all of us. So I'm hopeful that the National Governors Association will continue to take the lead. I know Governor Hogan has talked a lot about this and has testified on this in Congress as well.
Do you have at this point even a ballpark figure for how much the state of Vermont will need to deal with the damage from the coronavirus pandemic?
Yeah, very difficult to determine at this point in time because it's ongoing, right? Every day that goes by where we don't have businesses moving, we're not receiving any money either. So the longer this goes on, we'll be at a further disadvantage. So it's hard to put a number on this right now. We are already in conversation with the legislature about how we close out fiscal year 20, and then what do we do then, and how do we build a budget for 21 based on reality, and what can we expect from the federal government, if anything at all. At this point in time, I would say that we'll probably build a budget based on no money from the federal government coming through, and then work from there, because we have to be realistic. We can't build a budget based on hopes and dreams. We have to base a budget on reality.
Thank you very much.
All right, Sean, the Chester Telegraph.
Thank you. This is a question for Commissioner Sherling, and I'm wondering if you can give an update on what the 911 call centers are seeing in terms of domestic abuse calls, since we talked about this back at the beginning of April, which seems like a long time ago.
Commissioner Sherling, are you on?
I am, sir. Thanks for the question. The overall statewide call volumes remain down. I don't have the specific domestic violence numbers, but we can get those for you. My sense is that we haven't seen an uptick at this stage, but we can verify that and get back to you.
Thanks. Anything on when we last spoke, you also mentioned there was a slight uptick on suicides. Anything on that?
Yeah, also great question. We are pretty confident that that was a blip, if you will, sort of a confluence of events that had occurred over the prior weekend, but that the 2-week rolling average or the 1-month rolling average at that point was about average. So we're monitoring that on an ongoing basis, and want to recognize the great work that the Department of Mental Health has been doing over the last few weeks to accelerate overall mental health messaging on a variety of platforms.
Thank you.
Wilson, AP. Wilson, the AP.
Hi, as always. Thanks for lining up and taking all these questions from all of us. I have 2 questions. I can ask them both at the same time. Nationally, there's been so much discussion about testing and a lack of testing supplies and states competing against each other for testing supplies. It sounds to me like here in Vermont, we're pretty flush. Now, how did we become so flush with testing supplies? And then how do you think the federal response to the need for those testing supplies has been adequate? And then my second question is, I just looked at the health department's chart, and it says there are currently 49 patients hospitalized statewide, either COVID positives or suspected positives. and I don't know, what are they, 600 hospital beds in Vermont, more or less? Given that, when do you think it would be possible to start elective one hospitals again?
Yeah, both good questions. I'm going to ask some of the experts to chime in as well. I will say that in the beginning, we were challenged a bit in terms of testing. We have increased that testing capacity, but not for the great work of many. We wouldn't be in the position we are today, and looking for every creative opportunity that we can. For instance, when we found that we could have testing done at Mayo, but knowing that it would take 2 or 3 days or more to get the test results because of everything would have to go by parcel package, so to speak. So we had flights, daily flights that a number of people, and I think we talked about this last week, committed to. So that helped us out tremendously in trying to get real-time information back. Now we've been able to open up another door in Boston that will give us more opportunities. So everything that we've done has been the result of work by many trying to expand the testing, and I'm sure we would like to expand further if we can. In terms of your second part of the question was about elective surgeries, and I would just say that that's on the list. We are watching those numbers. I have had some conversations with other regional governors as well to see if what we can do to open up the spigot a little bit there, so that hip replacements and knee replacements and so forth can start again. But there's no time frame for that at this point. But it's on our list, it's on our minds, and we just want to make sure that we're continuing this trend before we, again, take away some of our capacity in our healthcare system, because that's important, right? There's two things we're watching, the capacity of the healthcare system as well as the number of positives that we see on a daily basis. So we want to make sure that we protect the healthcare capacity. Dr.
Okay,
Lee?
just a quick follow.
Yeah, Wilson, I'm just going to ask Dr. Levine to supplement what I said, and then you can ask your follow-up.
Okay, thanks.
There's some principles to be learned about testing, which are helpful. If I could just lead you through what testing is. Testing starts with collecting a specimen from the patient. So you need the appropriate swabs to do that. Sounds so simple, but that's actually complicated. You need to have the testing facility, and that has to be in the right place at the right time for the right patient. You need to have a viral transport media so that the swab that you got the secretions from the patient with goes into something where it will be preserved until the test is actually performed. You need to transport the specimens, so you need all the right conditions in terms of temperature and humidity and et cetera. Then you get to the lab, and you need to have the actual test. And the test requires chemical reagents and buffers and an extraction step where the RNA, the nucleic acid component from the virus, is extracted so that you have that ready. And then you need a second step called PCR, which is a special step that identifies that RNA as belonging to COVID-19, that specific coronavirus, as opposed to any other organism in the universe. So a lot of complicated steps along the way. So for the collection part, we've had to really work on making sure we have just the swabs and the right swabs for the right test. For the transport, we've partnered with the University of Vermont, and both our public health lab and the University of Vermont are making viral culture media and filling tubes with that. For the transport, you've heard a lot about flying to Mayo Clinic. We've been driving with state troopers to Boston. We've been having couriers bring samples from faraway parts of the state to Burlington, where they then get distributed to the various labs. When it comes to the chemical reagents, principle one is don't rely on one test platform alone. So have several kinds of tests that will accomplish the same thing, but on different machines with different chemical reagents. So at the State Health Lab, we have two so-called platforms that we use testing on. We've got at the University of Vermont 2 new ones that have just come online that they're hoping to have enough reagent to continue to do for a while. And then when we partner with Mayo and the Broad Institute in Boston, we have other platforms to take advantage that those labs may utilize. Every step of the way, you know, the principles are have multiple platforms, partner with your academic institutions in the state because they can be invaluable and ingenious in many ways in solving problems. Work in Washington with as many parts of the federal government as you can, whether it be FEMA, whether it be Health and Human Services, whether it be CDC, because you need to go down all of those avenues. Your other part of the question had to do with, you know, nationally, is this a problem? And I think I've outlined the fact that if it wasn't, we wouldn't have to be this ingenious about how we're going about solving the problem. So it's really taken a Herculean effort across the way, and that's why we're actually talking about stockpiling for our own state what we can, because we know the demand is going to continue and persist. I'll let Secretary Smith talk about the part about the hospital beds.
Wilson, first of all, I do want to sort of glom on to what the governor and Dr. Levine said. There's been a tremendous amount of work that continues even today in building our capacity for testing. There was one point where we were down to a couple of days of capacity, and through ingenious work, through hard work, through some luck, and some Vermonters and other people coming through for us, we have built that robust system that I just talked about a little earlier. UVM, the state lab, others that were flying samples, all deserve credit in terms of building what I would consider a robust testing capacity. Now, we have to continue every day to build that and stockpile that capacity as we move forward. In terms of hospital beds, and we are in very good shape in terms of hospital beds. We have thus far been able not to extend past the capacity of our hospitals. In fact, we have trended pretty much lower than we had originally expected in terms of use of hospital beds, including ICU beds. So all of that is very, very good news, and it's through the ability of surge planning that we did to have hospital beds and the ability to flatten the curve through all the things that the governor did that put us in this situation of both testing capacity and our hospital beds.
Okay, thank you. Actually, you answered my follow-up question that I was going to ask the governor, so, or the two of you did.
Wilson,
so thank you.
Wilson, I just want to add one thing because I want to give credit where credit's due. There was that point in time that Secretary Smith had mentioned that we were down to about 2 days worth of testing ability. And so I got on the phone with the vice president, and the vice president, I told them about our situation, and they came through and they delivered us tests to get us over the hump. So I just, again, you know, as much as sometimes I criticize the administration, I want to give credit when it's due as well. So they helped us out in our time of need.
Okay, thank you very much.
Greg, the county courier. Greg, county courier. All right, we're going to move to Ann Wallace-Allen, VT Digger.
Hi, thanks for taking my questions. My first one is about protests, some of the ones that are going on in other states. I know I've been hearing from people who want the state's economy opened up and are saying that that the governor or the administration is being too conservative. Governor, have you been hearing anything about protests, or what are you hearing from your constituents about your decision making?
I typically don't hear them saying that I'm too conservative, but but at this point in time, I'll take that. I'm cautious, and again, through the work that we've done thus far and the actions we've taken has put us in this situation. We're in the driver's seat, so to speak, and we've protected Vermont. We've saved lives as a result, and we should benefit from that as well. So just as quickly as we can, I want to open the spigot because I came from business. I understand, I feel their pain, and I understand their frustration. So as soon as we possibly can, we'll do this responsibly, open a little bit at a time to make sure that we're not exceeding the capacity of our healthcare system, and that we're not seeing a tremendous increase in the number of positives. Because we have to be clear, regardless of what we do, we're going to see, I believe, an increase in the number of people being infected by the coronavirus. But again, as I said, I think I said this last week, there are many people who think we're moving way too slow and that we should just flip the switch and open the economy back up. And there are those who think we're moving way too fast and we really need to slow down and not do anything for a period of time. So again, if we can manage through that somewhere like I've done my whole political life and try and manage it through the middle, I think we'll be successful.
All right. Thank you. This might be a question for Dr. Levine. Dr. Levine, you mentioned that there was some new understanding regarding children and adolescents, and I wondered, what is that? Is there some idea about a physical effect on children and adolescents that we hadn't heard about before?
No. I think more of an understanding of the potential value of assessing how much disease is present in that population and what state of symptoms they may or may not have at a time when they could transmit the disease to adults.
All right. I see. Thanks. And now this question, I think, is for Mike Harrington. Where are the extra 50 customer service reps provided by Maximus located?
I don't necessarily have that information. I do know they have multiple call centers. My understanding is that they are actually doing most of their call center work virtually, similar to our staff. So where they'll be located when they can go back to a facility, I don't know that. But at this time, I believe most of them will be virtual. I also just wanted to, I did the math when I stepped away, so I just want to make sure I get that number out there. The number per month cost could range anywhere from $200,000 to $400,000, just depending on how many customer service representatives we're using at any one time. So, does that answer your question?
All right. The other question I had is that you've mentioned that now there could be as many as 150 people answering the phones. Is that right?
Yes, ma'am.
What was it before?
Well, so prior to COVID-19, we had roughly 15 people answering the phone. So you can see the jump there. That's been onboarding people each week to go through our training process, pulling state staff. We've had a number, and I should just call them out specifically, a number of people who came out of retirement to come back to the department to provide resources. We have another 40 state staff that are being trained today as we speak and should be able to go live on our calls as well. So that number continues to increase. I don't think we're trying to reach a certain level. We will just onboard people as they come available.
Okay. And this is my last question, and it's back to Governor Scott. If a measure lands on your desk that would raise pay for essential workers, this is sort of to counteract the effect of employers saying that workers are leaving because they can make more money getting unemployment. Is that something that you would sign? Do you approve the idea of giving money to private sector workers to keep them on the job?
Here's what I can tell you. And again, I'm so grateful for those on the front line who are doing yeoman's work, incredible work to keep us all safe and keep some of these essential services going. At the same time, and I'll work with the legislature on this, and it's hard for me to say whether I sign something or not sign something. I would have to imagine that we'd have a conversation and work on this together. throughout the process, as we're going to with many other issues. But again, there's not an infinite amount of money. We've seen today or over the weekend with the state colleges and their need, the UVM, the hospitals, our own needs, the needs of the municipalities, the ongoing emergency, all kinds of things are going to be factored in terms of how much money do we have to spend and what's our highest priority. What is it that we can release and what are our expectations? Because again, at the end of the day, when we build our budget for 21, our new budget, it's going to be significantly less than before because we don't have the revenue. The revenues have dried up, and that is going to put a tremendous hole in our budget. So it's all about prioritizing. I know the legislature understands this. We're just going to have to put everything on the table and see where we go from here.
All right, thank you. That's it for me.
All right, I skipped somebody, so I have to go back to Avery Powell, WCAF.
Governor Scott, we've heard that there might be a hiring freeze in the state government. Is that something that's currently happening or something that's in discussion right now?
Yeah, I think Secretary Young is on the phone. I believe that we have stopped hiring at this point in time, just so that we can let things settle out. But Secretary Young, are you on the phone?
Yes, Governor, thank you. I'm on the phone. We've directed state agencies and departments to limit their discretionary spending in all areas and to limit any new hires except for those that are critical and essential to getting through the emergency. And that's effective through the end of the fiscal year, the next 2.5 months.
Okay, thank you.
All right, back to Neil Allen, the Vermont Standard. Neil?
Hi, how are you? My question is about the VLCT has sent 4 proposals to towns and cities about property tax abatement and the education fund. Is this something the legislature is working on, and how long might it be before something is voted on?
I believe the legislature is working on this, but maybe a better question for them at this point. I just don't recall, but I believe that they are. Is anybody else on the? I don't know if it's Secretary French or Secretary Young. If either of you have the answer to that.
Yes, Governor, this is Secretary Young. I do know that the legislature has been working with the League to figure out some relief in that respect for municipalities. Again, the state does not have control over those payments and when they're due, and so that clearly is a legislative issue.
Is there significant concern that the education taxes will not be paid and that there's that towns won't have tax money coming in general?
I'll answer that. Simple answer is yes. Yeah, we're concerned about every fund, every source of revenue, and we're seeing this across the board, whether it's in the private sector or in the public sector. So this is a concern for all of us. I would advocate, while I can, if anyone can pay their property taxes who are employed at this point in time, please do. Help your town out, help your community out. Pay your taxes if you can.
All right.
And that's it. Thank you.
Thank you.
Patricia Bennington Banner.
Hello, can you hear me?
We can.
Wonderful. It worked the first time this time. I believe this is probably a question for Commissioner Harrington. I just wanted to make sure I have this correct. Were all the individuals who were still waiting for checks to be issued to them in unemployment, assuming they qualified, have all of their issues been resolved, or have they otherwise been issued $1,200 checks by now, or is there anyone who hasn't been issued a $1,200 check or hasn't gotten their claims resolved? Is there anyone hanging out in the ether, so to speak?
Yeah, that's a concern of ours too, but let me just run you through the process. So we took everybody that opened an initial claim through the month of March and the first week of April. We then took that population and said, how many of these people were determined to be monetarily eligible? Now, you can be monetarily eligible but not eligible for unemployment insurance. So we took those that had at least been monetarily eligible, and then we began looking at the various issues that stop payments on claims. We were able to remove, a significant number of those. So we were able to whittle that down from what looked like probably 35,000 people, down to the 8,000 that the governor mentioned. There are some people that still have issues on their claims. These were, for us, issues we could not waive. There were concerns about legitimacy of claims, and there's a variety of others that just we were not comfortable making payments. So I would say that for those people who had very low-level issues on their claims, they were either paid either through benefits that went out Friday or today, and some will go out tomorrow, or they received the $1,200, which will be a prepayment on benefits they would have received anyways.
So just so I can clarify, you said for people that had low-level issues with their claims, they were paid through their benefits released last Friday, today, or tomorrow, and the others with those such claims that didn't get that, they received the $1,200 issued on Sunday. So if I understand you correctly, only the individuals with more serious issues with their claims have not been given either of those two things, correct?
Correct. And I should also point out, you mentioned, have their issues been resolved? And I just want to point out, we've released the issue, but we have not resolved the issue. So part of our job now has to move towards quality control, where we will be following back up with those that have had their issues released to make sure they are actually resolved in the end to ensure compliance.
And so if you know the number or if you have an idea of the number, approximately how many of those about 35,000 people have those serious issues, like the last holdouts, as it were, that were not issued money because there are concerns about serious challenges or serious issues with their claims? About how many people is that?
I can give a rough number, but there is no way to capture that because people can have multiple issues. Maybe what I should say is that, or I should say claims can have multiple issues. And these claims can range everything from, there's an issue number for if an individual is incarcerated. There's an issue number if someone voluntarily quits suitable work. There's an issue number if they were previously fired for misconduct. So those are ones where we really felt, in good conscience, we had to make sure we had a direct connection with those individuals before we issued payments on those. And that could range, I would say, in the 1,000 to 3,000, although I don't think it's that much. Some of these,
in the 1,000 to 3,000 person range.
Yes, or claim range. Again, we measure things in terms of claims, so some of these claims may also go back to pre-COVID times as well. So they could be claims that were in our adjudication process prior to March 15th. So again, that's why it's hard for me to give you a total number because it includes a number of different populations.
But this would be, roughly 1,000 to 3,000 claims at this point could not be resolved in the sense of issued funding anyway, and those were for things primarily related to suspected fraud or other types of issues that couldn't be resolved?
It could be any of those issues, whether it's fraud or just misunderstanding. So again, I'm not passing judgment on those, and I shouldn't. These people, it's not that they are not going to get paid unless they are deemed to be ineligible. This now gives us a much smaller subset to reach out to and adjudicate those claims, as opposed to going through 30,000 claims. So our focus will be on adjudicating those that are left.
Thank you.
Yeah, thank you.
Governor,
Governor, wait a second. I just want to clarify something with Patricia, because it's a forewarning, because we we are assuming you still may get calls about those who haven't received benefits because they're self-employed under the Pandemic Unemployment Act. This is something that was passed by Congress, new to Vermont, new to the entire United States. Nobody has been paid as a self-proprietor in the past, and now they're eligible for unemployment benefits. The programs, we're working feverishly to get the programs stood up so that they can be processed starting this week. So you're still going to hear from those who are self-employed. They have not received money at this point, but we've tried to make that clear. This was guidance that was just given to us maybe a week or so ago. We're working again feverishly to try and get that program stood up so that we can start processing these claims. I'm going to have Commissioner Harrington, because I just think it's a point that we need to make sure that we're forewarning everyone about this.
I think it's a good number for us to put out there. So typically on an average day, we under current circumstances have been averaging anywhere from 7,000 to 12,000 claims that are processed. On Friday, that was 17,000. We saw over 30,000 people actually file their weekly claim just on Sunday alone. So we know that in terms of this spigot, that spigot has been opened up, and more people are able to get through, and they are filing their weekly claims, and we expect that volume to continue throughout the week.
Governor, this is Beth Pierce. Do you mind if I add something to this conversation?
No, I'd love you to, Beth.
Okay, well, thank you very much. I think that, looking at this, there are financial and processing issues and risks associated with that. But I think that the state, we needed to weigh those against the needs of Vermonters. And there's no question that the needs of Vermonters came first, hence the authorization by the governor to release the 8,300 checks. And I just want to say that I think the governor made the right decision. We are in unprecedented circumstances and very much uncharted territory. And I want to thank the administration for taking that step, because I think it really made a difference in the lives of many people in Vermont. So thank you, Governor.
Yeah, thank you again, Treasurer Pierce. And who knows, we may be leaning on you again if we can't get this moving forward.
We all work together.
Yeah,
thank you, sir.
All right, Tommy, still reporter.
Can you hear me?
We can.
Thanks, Governor. Yesterday you called for seizing, these are questions regarding the Vermont State College system. You called for seizing the opportunity to save the state college system and use it to strengthen our entire education system from cradle to career. I'm wondering, in broad strokes, do you envision a sort of K through 16 scenario where the public colleges and universities are funded out of some new expanded version of the education fund? Or do you see this as an opportunity to just look at overhauling the entire K through 12 funding and governance as well?
Yeah, maybe all of the above. I think that we have an opportunity at this point in time to rethink our education system in its entirety. I've talked about this over the last 3 or 4 years. I don't think there's been a state of the state or budget address that I haven't mentioned the problems that we have with our education system. The amount of dollars that we spend, property taxes are a big issue for many in this state. So we spend, right now, we spend $1.8 billion for K through 12 and over $1.8 billion. And in terms of us helping out those in higher ed, probably another $100 million. And I saw a need where we needed to fund early care and learning as well. So I just think that we're spending a lot of money for education, and if we could better coordinate in some way, that we could, without raising taxes, without raising more money, we could have a much, much different scenario, much better situation in terms of education. And I've used this before. I've said, if I came to, there's a lot of smart people that are watching this right now, and if I went to them and gave you a check, offered you a check of $1.8 billion to educate our kids in K through 12, I would dare say our system would look much different than it does today. If you could, wipe the slate clean and start over. So I'm saying in this pandemic, in these unusual times, this may be the opportunity for us to get creative and develop the best education system possible, and the best system possibly in the country, maybe in the world. We're so small and unique and nimble. We should be able to do this, but we're all going to have to work together. And again, think outside the box so that we can preserve some of what we have, but give us a better product for our kids in the end.
And when you say kids, do you mean adults as well? Presumably, when in the colleges and higher education as part of that package, I guess.
Well, again, when I've called for more early care and learning and more higher ed, it obviously involves the full spectrum.
Thank you. My second question is over the weekend, Governor, the combined Northern Vermont University faculty assemblies voted no confidence in Chancellor Jeb Spalding, saying his recommendation was made, quote, precipitously, and it's part of a pattern of making decisions without transparency, adequate consultation, and data. As a member of the Vermont State College System's Board of Trustees, do you still support Mr. Spalding in his role as Chancellor?
You know, the trustees have been under immense pressure. They've been dealing with this for a number of years. There's been a lot of opportunities where Chancellor Spalding has come to the legislature to talk about those needs and to advocate for more money. So in some respects, this we should have seen coming. I think many of us did. I've been trying to put more money in the state colleges over the last few years, but it's obviously not enough. So it's not as though the trustees and Chancellor Spalding have not been advocating for this for quite some time, but this again with this pandemic, it's just accelerated and exacerbate the situation. So we just have to deal with this crisis now. There'll be plenty of time to figure out the other parts of this in the aftermath. But I think it's time for us to work together with the legislature, with the state colleges, with higher ed, to see what we can do in terms of education throughout the state, and all from, again, early care and learning all the way to higher education.
I mean, do you think the Chancellor got out too far ahead of this by making that recommendation on Friday afternoon, and it kind of came as a big surprise to a lot of people, and a lot of people reacted very quickly over the weekend? Do you think that was the wrong move to make that recommendation public so abruptly, or was this something that we all should have seen coming?
Yeah. Well, I think it was a little swift in some respects on Friday, and then have a vote on Monday. So I'm pleased to see that they decided to wait at least a week so that we can absorb this and consider this over the next at least 7 days. And so I think from that standpoint, it could have been rolled out differently. But again, I have to reiterate that this was something that the Chancellor and the trustees have been advocating for quite some time. They came to the legislature and to the administration with a plan asking for increased amounts of up to $25 million for them to stay afloat this year. So this is, again, this isn't unexpected, but this, again, accelerated the situation, this pandemic.
Thank you, Governor.
All right, just to give everybody a time check. It's 12:30, and we still have 10 folks on the line. Please, one question. If you have some follow-ups for clarity, that's fine, but just one line of questioning, and especially for those outlets who have multiple callers on. Andrew, Caledonia Record, you're up next. Andrew?
Good afternoon. Can you hear me? Yeah?
Yes. We can.
Yep. So you've already addressed some of the questions I was going to open with in terms of the no confidence votes coming from the faculty assemblies and alumni associations. I'm wondering, though, if you could speak to if the schools should end up being closed, what if anything, will the state be able to do to address the economic and social consequences that would occur in, particularly rural areas? I'm thinking of the Kingdom and NVU Linden, in terms of the schools being both a significant employer and really one of the principal pathways for local kids to advance into higher education.
Yeah, obviously I'm very concerned about the rural parts of our state. I've talked about this again over the last 3 or 4 years. A lot of the economic activity is focused on Chittenden County. That's part of the plan that that has become, I think, public at this point. That part of the mission, or the trustees feel as though putting more investment in Chittenden County is the answer as they close these other 2 facilities, or Johnson and Linden in particular. And from my standpoint, I would rather see, if we're going to invest money, I'd rather see the Chittenden County operation closed and try and do whatever we can to keep the other rural campuses open. So again, these are some of the conversations and discussions, debate we need to have as we move forward, and at what level are we willing to prioritize this, and what are we going to do without if we do decide to move forward to help the state college system continue to operate.
Just to follow up on that notion, one of the principal complaints that has arisen over the weekend from the large outcry is that folks feel the sacrifices of the cuts are not being evenly distributed around all regions of the state. So, I mean, is that something you recognize and you acknowledge that it favors Chittenden County more than others?
Yeah, absolutely. I believe that the ripple effect it will have in the rural parts of the state are significant, and particularly in Caledonia County, Lamoille County, and again we see time and time again we see statistics that we're fortunate to have Chittenden County in the mix and as an economic engine in some respects, but my focus has been to try and help all 14 counties, because one county's doing pretty well, the other 13 are struggling, and we're seeing that from a demographic trend all the way through to education opportunities in our K through 12 and so forth. So again, I'm of the mindset that we should be focusing on what we can do to help the rural parts of the state as well, because Chittenden County's doing okay right now.
Okay, thank you.
All right, Liam, VPR.
Hi, so I had a question around unemployment, and at this point it sounds like you've cleared a lot of the backlog of the thousands of folks who haven't been paid over the last month. And I'm wondering, do you feel that you now have sufficient capacity? Have you expanded the infrastructure and personnel needed to make sure that those thousands of people are going to be regularly receiving those benefits for the foreseeable future?
I'll answer part of that from my standpoint. I certainly hope so, and we'll continue to monitor this on a daily basis. And if we see the need to add more people or take other initiatives, we'll do so, because it's important again that we identify what the stumbling blocks are, what the challenges are, what the obstacles are, and rectify those. And we've done that over the last 3 to 4 days, and if we find more roadblocks, we'll make other changes as well. And if we have to add people, we'll do that. I'll have Commissioner Harrington answer anything further.
I think the governor nailed it. Some of these were system changes, some of these were one-time release of issues on claims. So we still have work ahead of us, but I think we have methods in place to expedite some of these. And some of this goes back now to individual claimants. They still need to be filing weekly and going in each week to file for the prior week. So again, I would just encourage those who hear this message to make sure you're going in and filing weekly, and only those who are coming to some type of standstill, then they should be contacting the department. We have multiple methods and ways to do that now, and I think in terms of bandwidth and capacity, we certainly are getting there with the call center, and we'll move through the issues as quickly as we can.
And I mean, in terms of the 8,300 or so folks who you issued those $1,200 checks to, who are still waiting for their more regular benefits to be coming in, will you be able to go through that and resolve those issues this week so they can start having regular benefits paid out?
Yeah, in some of these cases, they were actually individuals or claims that we had opened the door for them to file again. And it's a much more complex, and we can go into detail some other time, but they hadn't, and so some of this too is they will be able to file going forward. They just weren't going to receive payment in a timely fashion, and that's why we felt like we needed to move forward with this alternative step. So all of those people, there were, I can't say that all 8,000 had some block on their account. Some of them just needed to go in and file. Others will have to manage through.
Thank you.
Brittany, Local 22.
Hi. So my question is for Governor Scott. You talked about the benefit checks that were distributed this weekend, and you said you put the people above the process, and I was just wondering what went into making that decision, and also, do you expect any backlash from the federal government because we went around them?
Well, the first part is, I just I watch people. I see people who are suffering throughout Vermont through no fault of their own, and due to this pandemic that we didn't ask for. So we have a responsibility to take care of them. And when we saw the process wasn't working as well as we had hoped or expected, I just thought that we needed to take additional steps. So again, I give great credit to many in the Labor Department, as well as the Agency of Digital Services, the Treasurer's Office, the Finance Department, everyone coming together to find a way to get money in the pockets of Vermonters, which was important so that they could put food on their table, pay their bills, and just survive. I couldn't let that go any longer, and decided to take some risks in doing so. If we'll see, we may see some repercussions from this from the federal government. Time will tell, but we'll work through that and try and again give comfort to those who are in need and do what is expected of us. So we just took that move that I believe is of most benefit to Vermonters at this point.
Thank you.
Elizabeth Gribkoff, Digger.
Hi, this question is for Dr. Levine. According to a New York Times piece this weekend, Harvard researchers say that states need to be conducting around 152 acute infection tests per day for 100,000 people in order to reopen. And so according to their analysis, Vermont double the. I'm wondering if you agree with that assessment and why.
I heard all of the question except when you were talking about the numbers. You were cut out, and everyone around me didn't hear that.
Yeah,
either.
it's so.
That's better.
Sure. Okay. So the number that they said was 152 acute infection tests per day for 100,000 people in order to reopen, and that would basically mean Vermont would need to double the amount of testing that we're currently doing. So I'm wondering if you agree with that assessment and why or why not.
So if we say we're testing in the 500 range per day, and you ignore, the youngest in the population, we're close to that. We're not quite there yet. I can understand where they're coming from, and that's mostly from states that have, I think, a lot more disease activity currently than we've been showing more recently. So I can't argue with it by any means, but I'm not sure it's a goal we have to achieve because I think we're doing pretty well right now, especially with the one slide I didn't show you is the list of, not the list, but what we call our syndromic surveillance data. How many people are complaining of COVID-19 symptoms right now? And that curve actually goes steadily downhill, just like all the other curves I showed. And it's really just a couple percent of the population right now. So we would be probably testing a lot more asymptomatic people by the policy you just mentioned that Harvard was talking about, which is fine. But I think right now we're close to achieving that and don't have to go that much further to get there.
Okay, just one follow-up. I mean, you mentioned earlier in the press conference phase 2, and we've had declining test numbers the past few days. Do you think is that trend problematic to you?
Well, not really, because it's a weekend, and often on weekends, especially on Sundays, we see that drop. So I'd want to see that during the course of the next couple of days to more fully be able to answer your question, but I don't think so.
Okay, thanks.
Aaron Digger.
This is Erin from Digger. Can you hear me?
Ken.
All right. You said that you got on a phone call with Mike Pence to help get Vermont testing supplies early on. Can you tell us exactly when that conversation happened and what happened during the conversation, how it went down?
I can only tell you sometime in March, mid-March, when we saw I think the Department of Health, Dr. Levine, had sounded the alarm and said, we're running low on testing supplies, and it's going to take some action in order for us to continue to test, which we knew we needed at that point. So I, first of all, had contacted Governor Sununu in New Hampshire to see if he had extra testing capacity that he could lend us in our time of need. And when I spoke to him, he thought he was all set, but he didn't know that he could share any with us, that they had enough for whatever their needs were. But he said he would get back to me, and he called me back and said that actually they didn't have as much capacity as we did at that point in time, so that they were going to be in need. So we decided to do a joint call to the Vice President, which we did. And again, he listened to our concerns. He asked specific questions about what it is that we needed, how many we were using a day, and how many we needed to get through the next week or so. So after answering all those questions, he said that he would he'd see what he could do. We had another follow-up call, and he was able to assist us, and we received some test supplies as a result.
Okay, thank you. I also have a quick follow-up on the town-by-town results. If the state is not able to release exact town-by-town data for every case, is there any possibility that they could release just a number of cases in Burlington itself, because it is our largest city and seems to be connected with a large number of cases?
Secretary Smith weigh in.
Aaron, Mike Smith. I'll give you the same answer I gave Mike. Let us look into it and see what we can come up with.
Okay, thanks.
Aaron, the data Governor Scott and Governor Sununu spoke to Vice President Pence was March 14th.
Okay, thank you.
All right, up next we have Ham Davis.
Can you hear me?
We can.
This is the first. I've got two questions. The first question is for a combination of the governor and Dr. Levine. I'm curious, Governor, whether in your job of turning the spigot on with the getting the economy running again, whether you've been able, your people have run the epi curve run out, stripping out the strictly confined populations like nursing homes and prisons, and so that you can measure what's the real management job, it seems to me, in opening the economy is what's happening with the virus in the general population, not the confined population. Have you seen those? Those curves done that way?
I can't say that I've seen those done exactly the way you're proposing. I will say that every decision that we're making is in consultation with the EPI team. So Dr. Kelso, Dr. Levine, and others weigh in on any proposal that we're contemplating. So again, the step we took last week for today was in consultation and in discussion with them, so they were fully aware of what we were doing, and they gave us the thumbs up to proceed. So again, part of my cautious nature in this regard, I want to listen to the experts and make sure that we're following their guidance.
All
right, Dr.
I'm sorry.
Oh, go
I've
ahead.
got a question for Dr. The question is that the contact tracing has been a huge weapon in other countries, particularly South Korea and Germany. And what contact tracing means there is tracing in the general population, including people who do not have symptoms. I'm inferring from what both Mike Smith said about his confidence in the testing in prisons and in nursing homes. He calls that system robust. Is there any chance that you're going to be able to get contact tracing into the general population as you try and figure out how to get that spigot turned fully on?
Thanks for that question. It gives me a chance to explain a little about the process, because you'll find it's actually already in the general population. So by definition, contact tracing occurs after a case has been identified, usually by a test. That person is isolated. All of the known contacts to that person are then spoken with, whether they have symptoms or not. And in fact, the majority of the time, they don't have symptoms, so the importance of contact tracing is to see how significant the contact was with the case. Was it a sufficient amount of contact that one would think that the likelihood of getting infected was high? So that person usually hasn't developed symptoms at the time you're talking with them. They may in the future develop symptoms. So we then advise that individual to undergo a 14-day quarantine so that the entire incubation period of the virus can play out in them, if it's going to play out in them, while they are separate from other members of society, so that they themselves can't infect other people. So that's the whole principle behind contact tracing, and why it can be very effective, because you've allowed those people, when they are either asymptomatic or pre-symptomatic, to isolate themselves so no one else is in danger.
So thank you very much for that. I think what you've said is that my entrance was wrong, and I thank you for that. I got one more question from Mike Smith. I'm curious whether, when you're thinking about a little bit of a follow-up to Mike Donahue on this, is as we go forward, I think it's absolutely clear that the major issue coming, it's not visible yet, but it's there now, and that is the financing of the Vermont hospital system, whose budgets have to be approved in September by the Green Mountain Care Board. My question is, would you be willing to report, not town by town as Mike suggested, but would you report the distribution of confirmed cases, hospital by hospital, and also include Dartmouth-Hitchcock, because that doesn't get it to the town. You're going to have 3 or 4 towns and all of those small hospitals. You're going to have 7 or 8 or 9 or 10 towns that are regularly feeding into Dartmouth-Hitchcock. So could we see, in order to have a sense of how to manage the hospital system going forward, especially with reform in the budget. We need to know what's going on in each hospital, not just in each county.
Well, let me take, there's two answers in there to what I think is two questions. Let me take the first one, hospital finances. Obviously, we've been tracking hospital finances very carefully through this COVID-19 crisis and making sure that our healthcare system stays viable during this time. Now that means not only hospitals, that means providers, as well as those people like designated agencies and others who provide services. So throughout this crisis, we've been really monitoring that, and in some instances, we've had to help out various healthcare facilities in terms of finances. Secondly, I'm open to, given the fact that this comes hopefully every 100 years, I'm open to anything that gives us more data in terms of how we react and how we sort of look at our healthcare reform and healthcare system. So everything's on the table, Ham, including what you just mentioned.
I just want to add, Ham, and I don't know if this is what you're leading to, but whether a hospital has had COVID cases or not, they've been impacted by the pandemic because we've restricted the number of elected or any elective surgeries. So every single one of them has been impacted by the pandemic.
All right, we have just two more questioners. If we can hopefully wrap up by one. Guy Page.
Governor, I've heard there was a coordinated project among Vermont, Hawaii, North Dakota, and Idaho to build a new unemployment computer system because the feds were demanding an update, but it wasn't going well, and you pulled the plug on the project earlier this year. Can you confirm that and tell us what the problem was?
Yeah, that is true. I can tell you that we had a project with Idaho, and there was some other state. This was previous to this administration, but there was a consortium that was working on a joint effort, and Idaho was the lead on it. And then one state dropped out, and then North Dakota joined in, and then we weren't getting the results that we wanted out of this, and it wasn't working well at all. And this came about, I made the decision, seems like a few years ago, but it was probably 2 months ago, that we needed to pull the plug on that. We got together, the three governors, Governor Burgum, Governor Little, myself, and had a conversation about our expectations and what we could do to rectify it. We came to the conclusion that it wasn't going to work, and then we're going to try and salvage everything we could out of it, and that possibly we could consider working with North Dakota on the future. But at this point in time, then the pandemic hit. Again, we haven't not, that I'm aware of, worked on anything at this point in time, but we want to pick up the pieces after this is over and try and work towards, we may learn something as a result of what we're doing during this pandemic to guide us into what our needs are in the future. But we were working on a consortium that did not work out.
Thank you.
Final question from Tim McQuiston, Vermont Business Magazine.
Hi, Michael Harrington. I was asking about the PUA people. Many might also be 1099 employees or part-time employees, but their main gig would be as a sole proprietor, et cetera. Should they wait until the PUA system is up, or should they file? They might get some claims through the regular UI system. What should those folks be doing?
Yeah, so the process remains in terms of internally that they have to be uneligible for general UI before they can be eligible for pandemic assistance. There are two ways they can do that. They could certainly apply through general UI, just they would have to know that they're going to receive something in the mail that's going to tell them they're not eligible, and they just have to be prepared for that. But if they wait until the first phase of the PUA program is up, that will send them through both systems at the same time. And so they will be identified as not eligible for general UI, but eligible for PUA. So it really just depends on whether or not they want to get the rejection letter in the mail, or they just want to go through the process once and get through to the end.
Okay, and thank you. And quickly for Dr. Levine, I've noticed that there are increasing cases in Windham County, kind of an outlier there. Do you know if there's an explanation for why that might be?
There were, excuse me, the question was there were what about cases in Windham County?
The number of cases in Windham County seem to be an outlier. They've been growing sort of faster than the other outlying counties away from Chittenden County. Do you know why that might be?
Well, yeah, we did have a pop-up facility that went there, and a number of extra tests were done. Plus, they do have other facilities there, and I don't want to incriminate other states, but we have had cases come from other states that they border on as well, so perhaps that played a role. Don't have a full picture for you, just these little possibilities.
All right. Well, thank you very much. I appreciate it.
Thank you.
All right, thank you, everyone.
Thank you very much, and we'll see you on Wednesday. Thank you.